Hello, and welcome to the Clinical Liver Disease video series. CLD is an official digital learning publication of the AASLD. I'm Sarah Repking, nurse practitioner with Rush University Medical Center in Chicago, Illinois, and an associate editor with CLD. I'm here with Dr. Vicki Shah, who is the author of Could the Answer to NAFLD Be Hidden in Diabetic Therapy? She wrote this article while she was a PA at Rush University Medical Center, but has since transitioned to a medical science liaison at Gilead Sciences. Dr. Shah, thank you so much for joining us today.
Yeah, thanks for having me.
So a couple questions about this great article and so relevant for the times right now. So as you're well aware, there are no approved medications for NAFLD, now called metabolic liver disease. Can you review some of the current mechanisms of actions that are currently being investigated to help treat MASLD?
Yeah, of course. So the medications that are being investigated usually fall into three categories of target. The first one is inflammation, and then the second one's fibrosis, and the third one's lipid metabolism. The inflammation targets include using antioxidants and recruitment of macrophages into the liver. The fibrosis targets inhibit apoptosis, which is pro-fibrotic. And then lastly, lipid metabolism agents target metabolic pathways.
Okay, that was helpful. Thank you. Just to kind of break it down.
Yeah.
So the article, reviews current approved diabetic medications and if they're beneficial in metabolic liver disease. Can you give us just like a short overview of what that entails?
Yeah, so in the different categories, if we look at SGLT2 inhibitors and GLP-1 receptor agonists, these might improve hepatic steatosis and liver enzyme abnormalities in diabetic patients. However, some of them have only been effective in reducing steatosis when it's in addition to other medications. DPP-4 inhibitors have not shown improvement of MAFLD or serum markers of type 2 diabetes. And also to note, SGLT2 inhibitors, GLP-1 receptor agonists, and DPP-4 inhibitors did not meet any outcomes of hepatic fibrosis reversal. So that's very important to note.
So then how do you think these medications might be beneficial for those with metabolic liver disease if it didn't reverse fibrosis?
For those individuals with type 2 diabetes and MAFLD, the diabetic medications being investigated for treatment also have that secondary weight loss in obese patients, also reduce the progression of kidney disease, and decrease cardiovascular risk, which are all necessary targets that we need in our patients with type 2 diabetes. The secondary benefits are not seen with other agents that target inflammation and fibrosis. But to also note on these medications is that they were only investigated in lower risk patients who did not have advanced fibrosis. Therefore, the safety profile in cirrhotic patients was not established. However, one should consider a medication that targets fibrosis as a mechanism of action if there is a presence of advanced fibrosis or cirrhosis in fatty liver disease.
Okay, so looking ahead, what do you think we should expect in the future, targeting those with metabolic liver disease in terms of, medications to help treat, reverse inflammation and fibrosis?
That's a good question. There's a lot going on in the space. A lot of the future studies are expected to identify specific drivers and tailor treatment to each patient with MAFLD. However, we're going to need to consider these agents in type 2 diabetes with MAFLD, as there is that CV risk reduction and may improve steatosis. One thing that we also have to be aware of is that longer-term clinical trials are needed to see if this translates to decreased liver-related morbidity and mortality.
Dr. Shah, thank you. That was so great. And again, so relevant to the times right now as we're seeing this explosion of metabolic liver disease in the US and worldwide. Thank you again for joining us for another installment in the Clinical Liver Disease video series. And thank you all to you out there that are watching for joining us. On behalf of all of us on the CLD team, I hope you found this interview helpful. And for more information looking at diabetic therapy as a treatment for NAFLD, now known as metabolic liver disease, please visit us at www.cldlearning.com. And thanks again for watching.
Thank you.